right, we are going to go ahead and get started. Good evening, everyone. My name is Allison Flynn, and I am the Senior Health Policy Analyst here at the Medical Society of Virginia. Welcome to this evening's webinar, Advancing Care Through Collaboration, Virginia's Statewide Care Coordination Program. We are so pleased to welcome Marcus Stivers, the EDCC Program Manager at Virginia Health Information, Hannah Maddie, the Community Engagement Specialist at Virginia Health Information, and Morgan Croft Shornack, the Senior Solution Design Lead at Point Click Care. As is customary with all MSV webinars, I would like to cover just a couple points. Following the presentation today, we will open the floor for a Q&A. I would like to remind everyone to please utilize the Q&A function at the bottom of your screen to ask your questions. If a question is not answered, please email the MSV team at memberservice@msv.org. With introductions out of the way, I would like to just hand the floor over to our speakers.
So I'll go ahead and get this kicked off here. Like Allison said, my name is Marcus Stivers. I'm a program manager at Virginia Health Information. We are a nonprofit organization that administers a couple of different data collection and reporting programs on behalf of the state. One of those happens to be the state's Health Information Exchange, which is what the Emergency Department Care Coordination, or EDCC program, falls under. And then, Hannah, you want to give a quick introduction, and then Morgan, a little bit about Point Click Care?
Sure. Thanks, Marcus. So just like Marcus said, I work for Virginia Health Information. I am the community engagement specialist. I'm also a registered nurse, and I mainly try to assist with outreach and onboarding for organizations to join the Emergency Department Care Coordination Program.
Great. And my name is Morgan Croft Shornack. I have the pleasure of working very closely with Marcus and Hannah in the EDCC program. I am with Point Click Care, which is the technology partner to the EDCC program and has been since the program's inception. I am a licensed graduate social worker, and my role is really around showing how the solution works to support patient outcomes and efficiencies through different workflow opportunities in the clinical space. So really happy to be here today, and I'll pass it back to Marcus.
Awesome. Thanks for that, everyone. So quick agenda for today. I'll go over kind of a background of what the EDCC program is. Then I'll be handing off to Morgan to kind of go into the solution and what users and participants have access to. We'll go into a demo as well, so you can kind of see what that looks like if you're unfamiliar with it. And then Hannah will talk about how to get involved and how the program kind of works. So a little bit of background of the program. It's been around since 2017. As the name kind of states, the main goal of the program is kind of to address overutilization of the emergency department for non-acute services. So I know back in 2017, there's a lot of states and there's a lot of things happening in the health IT landscape where people were going to the emergency department and trying to figure out ways to better coordinate care across different facilities. And so there's a couple of states and a couple of organizations across the country that are really trying to figure out solutions to this to make sure healthcare providers were getting the information that they needed for their patients in a timely fashion to maybe help out or reduce the overutilization of the emergency department. Through some great work done in Virginia, there was actually legislation passed that stated that started and created the EDCC program, which is a statewide technology solution that helps connect your hospital emergency departments with other providers across the state by establishing real-time communication and information sharing between what we call downstream providers. So think your like free clinics, community service boards, primary care clinics, skilled nursing facilities, as well as your health plans and managed care organizations, Medicaid MCOs across the state. This, like I said, been in place since 2017. Again, this real-time information sharing allows us to get what we call admission, discharge, and transfer feeds from every hospital in the state of Virginia, which contains information like basic demographic, as well as basic demographic information, as well as information on that patient's encounter, including ICD-10 codes, admission date and time, as well as we get inpatient and observation stays as well. And what we do is when we get that information from the ADT alert, we can match that up with information that we are getting from health plans and other providers across the state. Health plans and downstream providers provide what we call a patient eligibility file, which is a similar file. It's that contains demographic information that basically tells us that this organization shares a TPO or treatment payment or healthcare operations relationship with that patient. And we match that demographic information up with what we're getting from the hospitals. And with that, we can give them real-time alerts and notifications for when their patients go to their emergency department. Again, that was the main use case that kind of started the program, focusing on care coordination. I'll say since that 2017 timeframe, we've really been focusing on ways that we can use those encounters in the EDCC program to enhance care coordination across the state, even with it's outside of the emergency department. You can see on the screen here a couple of our partner organizations that we work with on administering this program. Like I mentioned, this is a state legislative program, so we actually have an advisory council made up of many different members of different organizations across the state, including members from MSV. We also work really closely with the Virginia Department of Health on getting information, including we're getting COVID-19 lab results. We also get MDRO lab results that we can surface as a flag throughout the system, which Morgan will get into kind of what that looks like a little bit later. Like I mentioned, we work really closely with DMAS on the Medicaid MCO side. They've really helped us kind of focus in on also mental and behavioral health and maternal health use cases for the program over the past couple of years. We've been working really closely with DBHDS on the Community Services Board side, which we have about 20 community service boards participating on the state, working with patients with behavioral health issues, as well as we're working to get inpatient psych hospitals on board to the program as well. We also get information from the prescription monitoring program as part of our partnership with Virginia Department of Health Professions, where we can surface NARC scores inside the program as well. For those hospital users joining, or maybe if you're a downstream provider kind of learning how hospitals use the program, you might be familiar with something called the EDDI report or EDI report or EDDI alert. And this is actually how we page notification that we pull down from information that we collect from hospitals, as well as our downstream providers and health plans, and surface this inside the emergency department and many ED track boards throughout the state. We have a set of core criteria that we'll get into a little bit later that triggers this inside the emergency department. And kind of speaking, I just wanted to show you guys kind of what it looks like through across the state. We have about 6,000 different users registered with a EDCC portal, but that represents over 400 different facilities across the state that are participating, sharing data. And with that being said, I'll go ahead and move on to the solutions. Morgan, are you good from here?
Yes, thank you so much. So with all that background in mind, what we wanted to do is actually talk you through what features and functionality the EDCC provides for various types of organizations. And as Marcus mentioned, the EDCC program is available to all hospitals as well as downstream providers, and participating, we have health plans, MCOs, a variety of healthcare organizations. So we want to talk about at a high level what the EDCC provides. First, identifying risk. So we are able to identify the risk within your patient population and produce intelligent alerts based off of that risk. These are delivered to each organization, whether it's a hospital, health plan, or downstream provider, in a consumable format that fits each organization's particular workflow. And we're able to do that all in real time in a matter of minutes after the patient has had an acute encounter. The notifications are going to include visibility into the patient's care team, really to support that great care coordination effort and allow each care team member to see who has a relationship with that patient to better do things like discharge planning, follow up care, and connecting with community resources. We also have a feature called Care Insights or Care Plans, and these allow providers and care team members to add information to the EDCC program that will follow the patient no matter where they go. Because we all know that we live in a very disparate technology healthcare system. And so, regardless if the patient goes to a hospital that is on Epic, Cerner, Meditech, or something else, the EDCC will surface this information regardless of where that patient is going. And we often recommend providing care recommendations and how to support that patient when they present to the emergency department or another care setting. And then finally, through all of the great partnerships that we have that Marcus mentioned on one of the previous slides, we're able to surface statewide flags related to substance exposed infants and multi drug resistant organism lab results. Again, really to surface information to improve patient outcomes, workflow in each of the individual organizations that are participating in the EDCC, and give the visibility that each of those care team members needs. We'll go to the next slide. And I want to talk a little bit about how this actually works, how the data moves through the EDCC program. We receive data a couple of different ways. First, hospitals are typically sending us an admission, discharge, and transfer feed that we consume in real time. And then other organizations typically will send us a file identifying who their patients, clients, or members are. We consume those, and when that patient goes to the emergency department, for example, and registration adds their information into the EMR, we consume that and patient match that against all of the information we have across Virginia. This allows us to match that patient up and identify if they meet any risk criteria for the hospital that they are presently at, or for any of the care team members that has that TPO HIPAA compliant relationship with them. If that patient does meet a criteria, the hospital can receive a notification directly integrated into their EMR track board, and other providers are able to receive notifications that are available in their workflow or in our unique web-based portal. Again, these happen in real time. So from the time a patient enters the hospital to that notification being sent out, this is a matter of 1 to 2 minutes. At this point, the notification or the portal information provides each care team member with the information that they need to be able to take the appropriate action and improve that great care coordination and the follow up and services that the patient might need. We'll go to the next slide here. And I want to talk about what criteria might trigger a notification. We have a set of core criteria. For the hospitals, it's a little bit different, and for the downstream providers, it's a little bit different depending on the unique needs of each organization. The core criteria first is going to center around patients with patterns of high utilization. So patients who have 5 or more emergency department encounters in the last 12 months. And then we have rising risk or patients who have been traveling. Rising risk falls more on the downstream provider side. So that would be having 3 or more ED encounters in the last 90 days. The purpose of this is to try to capture when those patients start to see an increase in their acute utilization so that the downstream provider, which is anybody outside of a hospital or health plan, So we're thinking about community service boards, primary care specialists. Anytime their patients start to see an increase in acute utilization, they can receive those notifications so that they can intervene. For the hospitals, we're looking at patients that might be traveling or visiting multiple emergency departments. So this would be 3 or more ED locations in the last 90 days. Next, we have prescription monitoring information. Today, this will surface NARC scores, and this is available in the emergency department to support prescribers. And when a patient meets the NARC score for a notification, that will trigger so that they can receive that information on their notification. The next two are safety and security events and care insights. This is information that is entered into the EDCC portal and produces notifications for that patient moving forward. Safety and security, as it sounds, is focused on reducing workplace violence and keeping patients and staff safe. So, when a safety or security risk or event has happened, that hospital or organization can add information about what took place, any potential triggers and de escalation techniques into the portal, and that will produce the notification next time that person has a encounter at a hospital. Care insights, we mentioned this a little bit earlier, but these are the care recommendations that will follow that patient regardless of what EMR. Again, recommendations on how best to support this person, who is working with them, contact information, things like that to really improve the patient outcome there. Skilled nursing facility encounters are also available. Point Click Care as the technology vendor and partner to the EDCC program, and also a primary EMR for skilled nursing facilities. We're able to surface SNF encounters into the EDCC. So you have visibility into when patients have moved from a skilled nursing facility into um, the acute setting or have discharged from a skilled nursing facility to coordinate that follow-up. We also surface advanced directives, MDRO lab results, and if there is an infant who has a positive result for substance exposure, we're going to surface that as well. For hospitals and downstream providers, we also have the opportunity to focus into behavioral health and substance use disorder. So we can take a look at ED visits with any specific diagnosis related to mental or behavioral health, anything related to suicide or opioid use, as well as alcohol use. These are going to surface as notifications either in the emergency department track board. We are always going to have them available in the portal that each organization has, and we can send notifications via email and text message. You can see the examples of these on this slide here. We'll go ahead to the next slide. Next, I want to focus in a little bit more on how we send the notifications. And I want to start with discussing a little bit about from the hospital side, how we can surface that information directly in the EMR and how that information can be accessed. So again, every hospital in Virginia is already set up with this. So you likely already have it in your emergency department and often called the EDI alert, the EDI report. There are other opportunities to kind of integrate further through our Smart on Fire application, but a lot of hospitals today are set up with notifications that typically will surface as a PDF directly in the emergency department track board. So we'll go ahead to the next slide and dig a little bit more into that. The Smart on Fire application is a really great integration opportunity. So when a patient meets a criteria for the hospital, that patient is going to trigger that alert and it will show up as an icon on the ED track board. You can click on that icon and it will produce the what is commonly referred to as the EDI alert, but the notification, and it will take you through the high level information that the emergency department needs to know when seeing that patient. The benefit of having a Smart on Fire integration is if you would like to add additional information, such as safety and security events or care insights, you can do this directly through the Smart on Fire integration in your trackboard. You do not have to leave the trackboard to do this. The other benefit is you're able to see the prescription drug monitoring program information directly within the Smart on Fire application as well. We'll go to the next slide. And the other opportunity for integration is through our ED trackboard integration in a more typical sense, which is sort of the icon populating on the trackboard as we just discussed. Once you click on it, though, it's going to typically be a PDF document and again, surface the same information that the Smart on Fire application would. The difference here is this is a PDF, one-page notification, and if you would like to add information, you would scroll to the bottom. There's a link on the bottom of that notification. You would click on that and it would direct you to your organization's portal where you can view more information and add information such as safety and security events and care insights as well. We'll go to the next slide here. So those are just the different notification types. And I'll just mention also on the downstream provider side that we can send notifications via text message and email. These do not contain PHI, simply alert the team that there is a patient or a client that has met a criteria and would direct them to log into the portal. I want to focus in next on our MDRO flags and notifications here. And this is visible in the portal and on the one-page notification. But essentially, there is a rise of multi-drug resistant organisms, which is posing a public health risk. And so there's a lot of effort in the public health space to ensure that that information is available to healthcare providers, particularly infection prevention teams in hospitals, as well as in skilled nursing facilities. So the EDCC receives this lab information, and we're going to surface any patients that meet the criteria of having a positive MDRO lab result and putting that flag on their patient overview page, which can also trigger criteria in the hospital so that the providers know that right away. And we can actually also set up notifications to go directly to infection prevention teams to get them engaged as needed. This is really important for being able to treat patients who have an MDRO in the appropriate manner and make sure that the appropriate infection prevention methods are being engaged right away. So this is a very popular and important piece of the EDCC program. When we go to the next slide here. Similarly, we are surfacing flags for substance exposed infants. And again, this is going to be a flag similar to the MDRO flag on the patient overview page and on the notifications. But essentially, we're taking a look at any infants in Virginia that have been substance exposed so that we can trigger that notification for the emergency department and give visibility into that substance exposure to downstream providers as well. Really with the intention of making sure that that baby and that family get the support that they need if they do present to the emergency department and downstream so that their care team is aware of this and able to engage them in any services, case management, care management, any primary care or specialty care that they might need, and really supports the sharing of safe plans of care for those infants. So this is available in the EDCC today on the portal and notifications, and this produces that flag. So you might start to see that as well. We will go to the next slide, and I want to actually transition a little bit and actually show a demonstration of the different integration opportunities for hospitals as well as the portal. I'll go ahead and pause here, and I'm actually going to take over sharing so that I can share my screen. Okay. All right. Marcus, can you just confirm that you're seeing my screen now?
Yep, looks good to me.
Okay, great. So I wanted to show you a real-time example of our integration opportunities to show you potential workflow. And I want to start with the hospital point of view. So what you're seeing here is all demo information, so no real patient information is going to be surfaced here. I want to start off by showing you what it looks like on an ED track board. So this is just our example here. And you can see in the alerts column that there are several alerts here. This one is the ED notification. And when I click on this, it is going to produce a one-page notification for me. It's going to look like this. At the top, you're going to be able to see who the patient was that triggered that notification, as well as why they triggered the notification or the criteria that they met. So in this case, we can see that there was a safety and security event. This patient has been traveling, has patterns of high utilization. There's some care insight information, as well as some PDMP information. You're going to see right away the safety and security information. We like to keep that at the top as this is something that can really support your team in being proactive, working with patients that have some sort of risk. So we can take a look at when and where that safety and security event took place, the type of event it was, and then some specifics here, some additional details about what happened. We have notable patient groups. So these are ways for hospitals as well as downstream providers to internally designate their patients into specific groups. So we can see here that this hospital has noted that this patient is in a high risk group and has a history of homelessness. Next, we can see those care insights. So we can see right away that Mount Virginia Behavioral Health provided some information about Sally regarding an anxiety disorder, some of her triggers, as well as some information about her care team and how to support her in the hospital. We see that she has a history of opioid use and that she does receive medication assisted treatment and that there's a pain agreement provided as well. We also see some information about social determinants of health, and again, that history of housing insecurity, and that she has an application pending at Housing Works. So, this is helpful information for me to have potentially as an ED social worker or care manager, case manager working with her. And then that she has children in foster care and often leaves against medical advice. So the purpose of this is really to give you insight into this patient, their history, what might be bringing them to the emergency department, and how to best support them. As we scroll down, we can also see the recent emergency department visit summary. So the recent encounters that she has had in the last 12 months, where that took place, and what brought her to the emergency department. So we can see that there's a little bit of a trend here related to substance use and some mental health. We can see the different facilities that she has been seen at. So we can see this is where that traveling criteria was met. We also see that she had an inpatient encounter here and when that took place. We're going to surface the PDMP information as well as the care team at the bottom. So this is really great for the care coordination efforts and discharge planning. Now at the bottom of the notification, you're going to see a link here. You'd be able to click on this link and it would take you to her patient overview page in the portal that you have set up. Every hospital has a portal available already, and so you have the opportunity to be credentialed there and have access. So this is one way that we can surface information in the track board. Another option we have is the Smart on Fire integration. So I'll quickly walk through that and also show you another opportunity here. So this is another example of the emergency department track board, and I actually want to take a look at Ramesh. The reason I want to take a look at him is because he has this icon here related to skilled nursing facility. A newer opportunity we have for hospitals in Virginia is to add an additional criteria around patients that have recently transferred from or discharged from a skilled nursing facility and are presenting to the emergency department. So this patient meets that criteria. So I'm going to actually click on that. And you can see here that it brings me to the intelligent alert within the Smart on Fire app. So at the top, you're going to be able to see, again, who that patient was, why they were triggering that criteria. So we see there's some care insights as well as that SNF summary. So this patient was recently discharged or transferred from a skilled nursing facility. What we see often for hospitals is that those patients don't come with a lot of information about what happened with the skilled nursing facility care that they were receiving. So we are actually pulling that directly from the EMR and surfacing it here for the hospital. So we'll see the patient return from SNF. We're going to be able to see the visit summary. So when they were admitted to which facility and what the diagnoses were. So we can see that he was there for congestive heart failure at Madeline Skilled Nursing Facility. We can see who that attending physician was at that skilled nursing facility and what their contact information is. This is really helpful when we're thinking about discharge planning and returning the patient to the skilled nursing facility if they need ongoing care. And then we're going to be able to see the last 14 days of medications from the skilled nursing facility. This is really valuable so that we reduce any medication errors. We're not duplicating medications or providing any medications that should not be prescribed together. So you can see the details about the medication, the dose, and the day and time that those were administered. This is a really great opportunity, both for a further integration and with the SNF summary piece, giving the emergency department information that they might not have when their patients are coming to them from skilled nursing facilities. The rest of the notification looks very similar to what we already covered. So we have some information from care insights. We'll have the ED and inpatient visit summaries, as well as the care team down at the bottom. Now with the Smart on Fire integration, we have the opportunity to add information directly into the Smart on Fire app without having to go to the portal. So I just clicked on safety and security. I can add information here. So I'm going to pick the type of event and you can add information into this box. Click save, and that is going to be added to the patient's notifications moving forward. Very similarly with collaborative insights, if there's some information I want to add about how to support this person in the emergency department or another care setting, I can go ahead and add that information here as well. So a really great opportunity to further integrate. And if your hospital is interested in doing this, we'd be happy to work with you on that. I am going to transition over to our portal view and show you what it would look like if you were to log into your portal and actually go to a patient overview page. So I'm in Ruby Valley Medical Center here. This is a hospital, again, demo information, so no real patient information. But as we've mentioned, every hospital in Virginia has access to this already. If you need access and don't have it today, you can reach out to the account manager at your facility, or you can reach out to us at the EDCC program and we can identify for you who that is. So I'm actually on a patient overview page. So the workflow example here is I received a PDF one-page notification for Jack. I clicked at the bottom of the screen, the link, I logged in and it took me directly to his page so I could view more information and potentially add information that I have. So immediately at the top, I'm seeing that there's a recent security event. So we like to, again, put this at the top so that this is front and center for being proactive with our workflows, potentially engaging our security team on the front end to support this patient while they're at the facility. If I want to, I can actually click on the security event and it will bring me all the way down to that section right away. We're going to get there as we move through this page, but I just like to mention that. Next, we have our demographic information. So we can see Jack here. We can see all of the demographic information that he provided to Ruby Valley Medical Center. A couple of things to point out here. We see a little red house. This indicates a history of housing insecurity or homelessness. This information is being pulled from the files and feeds that we're receiving. And if there's an indication that the patient does have that history, we're going to apply that red house. This is very valuable for hospitals to know, particularly if we have patients that are coming in for secondary gain reasons or downstream providers if they're unsure what needs the patient or client might have. This is a really good starting point. Another great feature is the phone number. So this is the phone number that Jack provided to this organization. And maybe we need to get a hold of Jack after he's left for some reason. Maybe we got some critical lab results back, something like that. We need to follow up with him, but this phone number is no longer working. We can click View More, and it's going to provide me with all of the other phone numbers that this person has provided at any other organization or facility. We see this particularly valuable for community service boards, any organizations working with populations that might move around a little bit more, substance use disorder, things like that. Just because phone numbers might be changing frequently and getting in touch with patients can be half the battle. This is true of all of our demographic features. So particularly if you have patients who may be using different names, we can still match those patients up and you might be able to see if they're using a different name at different facilities. Next, we have our flags and tags section. So the first thing that you're seeing here is an MDRO lab result. So this is where you would see that as well as the substance exposed infant lab result there, or the result there. You'd be able to hover over that. It would give you a little bit more information. And this also would surface on the one-page notifications. You can't add or remove this. This is added and removed kind of on the back end. But we do have the opportunity here to create some custom tags, which create groups of patients. This is an optional feature. These tags that you see here are round and they have the X. These are internal to this organization only. And they essentially group together patients that have that same tag and have the ability to create reports in our patient groups tab. So we see these listed here. We can also add completely custom tags. So an example here is if you want to break them down by case manager or program. So I'll just do Morgan caseload. I can go ahead and add that. I'm going to do that one more time. And now you see that that's added, but I can also click the X to have that removed. Again, a completely optional feature, but can be really helpful for organizations that run many different programs, have several different locations, or want to group together patients or members or clients by any specific group or person or program. Next, we have our care team. So this is going to show all of the care team members that have a relationship with this patient. This is produced through the files and feeds that come into the EDCC program, and each organization has the opportunity to identify themselves as a care team member. These can also be added manually by adding the provider button here, and you can add yourself as well. Again, this is really helpful for care coordination efforts, both in the hospital and in the downstream providers, so that they know who has a relationship with the patient and how to coordinate care or where to direct them for follow-up. So Jack already has family medicine provider, some case management through his health plan, a specialist, home health, and a skilled nursing facility. So this is really good information for me if I'm working with him. Next, we have our encounters. So this is going to be the list of those encounters that this person has had from the feeds that we are receiving. So you're going to see emergency, observation, inpatient, and skilled nursing facility information here. So we can see the date and time that that happened, where the encounter took place, the type of encounter it was, as well as the diagnosis and chief complaint, which are updated in real time as that patient moves throughout their journey. We can also click on the date and time, and it will give us a little bit more information, such as who the attending physician was, the insurance that they provided at that visit, as well as the discharge disposition and diagnoses. This is helpful to be able to understand better what's bringing the patient to their acute encounters or what they've been in post-acute care for. Helps with trending and understanding a little bit more about what's going on with that person. You're going to be able to see up to 24 months of information here. So it gives you a nice, good long look back period as well. Next, we have our care insights, which we've talked about already. Here's where you can add and view them from the portal. So if you have additional information that you want to add, such as information about Jack's usual state of health, you can click enter baseline presentation. It's going to pull up a box here where you can add free text. Once you click save, that will now show up on the notifications for the hospital and be present in the portal here for other care team members to view. We have several different categories here that you can review, and several of them also have the opportunity to add attachments, such as a crisis plan, pain agreement, or a hospital homelessness discharge plan. And then finally at the bottom, we have the safety and security events. So if I were to at the top from that banner have clicked security event, it would have brought me directly here. Otherwise, we just got to the bottom of this page here where we can see that there was a physical event and an elopement that Jack had, where that happened and when, and a little bit more information and details about those events. Now, if I wanted to add a safety and security event, I can do that by clicking Add Safety and Security Event. I would click the event type. We have several options here, or you can click Other. So we'll say that there was a verbal event. You would select the encounter that it was associated with. We'll have some pre-populated issue notes for you here so you can easily add which one is most appropriate. And then a free text box here as well to add some information. I always recommend that if you can add information about what triggered the safety and security event or de-escalated it or was not helpful, that's good information for the future. Once you click save, it will be added here, just like you see these two other events. So that is the patient overview page. And one last thing I'll mention here is particularly for downstream providers who are doing follow-up for acute encounters, or if you have a patient that you have never seen before in the hospital and you see that they had an encounter at another facility, but you want some more information on what took place there, we do have the CCD functionality here. These are continuity of care documents, and we source these through an integration with Care Quality and Commonwealth. Once CCDs are available, this button is blue and you'll be able to click on that. This patient has just one available, others will have many more. You can click into this and this is going to give you more rich clinical data associated with that encounter. So for example, if you're doing some medication reconciliation work after an acute encounter, we have the list of medications here in the CCD. Or if you wanted to see what procedures were already done at a previous hospital visit, you could check here to see that list as well. There's a lot of other great information in here that we're sourcing from the CCD. So just like to mention this as a way to get some more rich clinical data in addition to the ADT information. I just want to close the loop on the tags here. So I'm going to hop over to our patient groups. We added Morgan's caseload here, and I'm going to go to this tab. And this is where you're going to see all of the patient tags that we've added and the patients that were associated with them. So under my facility, I can see Morgan's caseload and I see Jack on this list. As I add more patients to this tag or this tag to more patients, this list is going to grow. This is a great outreach list, a great way for me to kind of manage this patient group. I can click on Jack's name and it will take me back to his page, or I can download this as an Excel or PDF, and I can change the information I see on this report by clicking on the gear icon, configure tag columns, and maybe I don't need the MRN, but I do want the phone number because I'm going to follow up with these individuals. So I just swapped those out, click save, okay, and now I see that phone number instead of the MRN. So just a great way for you to be able to get some real-time reports and lists. And we have the opportunity to also schedule reports daily, weekly, or monthly. So if anyone is interested in quality reporting, anything related to data analysis, or just getting some quick, easy reports out of the portal, we are happy to work with you on that as well. You tell us what you'd like to see on there. We'll make them available at whatever cadence you'd like, and you can download them by clicking on them here. And you can take a look at a quick preview of what is in that report by clicking the preview icon. Those are the key features of the portal that I wanted to mention and walk through. So I'm actually going to stop sharing my screen here, and I'm going to, I believe, pass it off to Hannah or Marcus to take it from here.
Awesome. I think I went ahead and shared the slides again. Can everyone see them okay?
Yes.
Awesome. And so, Morgan, thanks for doing that. I think we're going to highlight a couple of success stories, so feel free to hop in here. But one success story we wanted to highlight was one where Family Insights, which is a downstream provider focusing on behavioral health, uses the portal a ton to follow up on their patients after they leave the emergency department or when they're discharged. They specifically use it a lot around medication reconciliation. Touched on a little bit, but there is a CCD functionality that does have some more clinical information in the portal that you can click on and get medication information if it's available or sent by the hospital, as well as like immunization information, vaccine information, and a couple other things that might not be found in that encounter data and ADT feeds. And they work really closely with entering in care insights and have found some real success for patients when they're entering in those and utilizing the portal in ED reduction and reducing ED visits and hospitalizations throughout their patients population. And the next example, Morgan, did you want to take this one?
Sure. Yeah, so this is a great example of a great care coordination that the EDCC supports. So this is a patient example that's been de-identified, but Laura, so she's a 41-year-old who has complex care needs and multiple chronic conditions with a history of opioid dependency. And really, in this case, she had been utilizing the emergency department because she was not getting the care that she needed at the appropriate level. So she had, unmet or undiagnosed conditions, and her care plan was uploaded to the EDCC program, which included multiple specialists and outpatient treatments that she was receiving, as well as recommendations on the most effective and appropriate pain management that worked best for her. So the health plan contributed a care insight so that the emergency department also had visibility into what benefits she had available through her health plan. The hospital care coordinator utilized the EDCC to author that care plan to share with other care team members, which triggered the notification for the hospital when she was going to the ED. And in the care team, We were able to see who her primary care provider was, and 10 or more other care team member contacts were available within the portal to ensure that when she did present to the hospital, they knew what the right next step was for her to receive the care that she needed. And in this case, over time, we were able to see a reduction in her emergency department utilization, which was a result of the health plan, the hospital, and her downstream providers all working together and coordinating care through the visibility that the EDCC provided. So, a really great success story of an individual patient.
Thanks for that. And then I think Hannah's going to kick it away for how do you get involved if you learned all about this portal? How do you get set up?
Thanks so much, Marcus and Morgan. So for new organizations that are looking to join the EDCC platform, what we would do is your organization will fill out what we call a discovery form, which just tells us a little bit more about your organization and the services that you provide, and give us a couple of more contacts, like IT contacts, the people we would need to communicate with in order to begin that implementation process and training. After that, we will schedule a personalized EDCC program demonstration where we can answer any questions that you may have and sort of go through the ins and outs of the platform, kind of like what Morgan just did. After that, we'll have you sign our exchange trust agreement, which is our legal agreement that we have everyone sign. And basically, it just tells everybody what you need to know in terms of the HIPAA requirements. Obviously, sharing any type of sensitive medical information, we're going to need to sign some legal paperwork. And then we'll hand you off to the Point Click Care team to actually create your organization's portal and begin those trainings, set you up with the sending of your patient roster file and making sure that everything is to the exact sort of requirements that we'll need with your patient population to do that patient matching that we do across the care continuum. And then you are ready to sort of join with the other organizations that have already onboarded. And what we do to bring everyone that has been onboarded to the EDCC program, all of our active users, we encourage you to join what we call our EDCC collaboratives. Next slide, please. So what are the EDCC collaboratives? We have a statewide EDCC collaborative, and then we also have regional collaboratives. So what we do is we get everybody who uses the platform together and we talk about ways that we can improve the usage. We talk about how we can expand the usage of the platform and enhance our care collaboration. And also we talk about what everyone is doing. We'll have people present on how they are utilizing the platform to help their certain patient populations. We have people on the downstream side, and we also have people on the hospital side so that we can really bring everyone together and talk about how we utilize this platform. We have nurses, community providers, health plans also join. And we really try to get everyone to share their experience and their needs. We ask for wish lists because we're constantly trying to improve. We know that nothing is ever going to be perfect, but we really want to help everyone use this tool in a very productive way to really enhance these patient outcomes as best we can. Next slide, please. So in talking about those regional collaboratives, we try to also drive this sort of local engagement within the EDCC community. We have a Tidewater collaborative, which you see listed here. And over here on the bottom, you can see some of our major participants that really sort of drive this engagement with the platform. And the people that attend these collaboratives are usually very engaged with the EDCC program. And it's really wonderful to see everyone coming together in these different collaboratives to share their experience. And you can see down here at the bottom, we have these key deliverables listed. Formalizing these care plans so that everyone can work together to really work with the whole patient, which is really important to us. Next slide, please. And then you see here that we have another one of our regional collaboratives, which is the Central Region Collaborative. And what's really great about this one is that it is chaired by one of our members from UVA, our patient population health team over at UVA. And they have had huge success with using the EDCC platform. You can see again some of our key deliverables from this regional collaborative, developing these relationships between clinicians. And these relationships to improve these patient outcomes on the regional level have been really, really successful. We develop these metrics, we put together goals, we, try to drive these different outreach initiatives to raise the awareness, to really try to spearhead this utilization of the EDCC platform. And again, with the main goal of care collaboration. And we see that it is very successful in these different regions and again, statewide. Next slide, please. So now I'm going to go ahead and hand it back over to Marcus. Thanks so much.
So last little bit, I know you've been hearing us talk for a while and how great the EDCC program and all the ways it can use. And what I got to tell you guys is it's only getting better. So and as part of the EDCC program, like I mentioned at the beginning, the legislation's been around since 2017. We started onboarding people in 2018, getting the hospitals and health plans participating. And since then, we've been getting other groups of participants, downstream providers, managed care entities, ACOs, all on the network to add up to the 6,000 users. Recently, there's legislation that passed that actually expands the scope of what information is going to be collected. I know I mentioned at the beginning that we're working with getting inpatient psych hospitals onboarded, which is the new kind of mandatory participant in the program, as well as it actually expanded the types of data outside of just that ADT information that we're looking to collect. So we have started a process and initiated kind of some discovery on that. The main forms of information that have been added are lab results and image results, as well as the addition of additional care coordination information, which is what we're working with our advisory council and current users to help define and figure out what type of information would be useful to be exchanged in this manner and through the program. And again, Morgan mentioned it earlier. One of the big things is, especially for hospital users, is working on getting that Smart on Fire integration, so making it easier for people to be able to both view and share information across the network without leaving their EMR. And we're also exploring other options for providers to basically get that information and share it back and forth for the program as much as possible. So with that being said, I think that's kind of all that we have as part of the program. I'll see if I can open up, or we can check the Q&A. I'm not seeing anything. But if you have any questions, I know this is a lot of information. We have a couple of flyers that we can hand out. We actually just finished up at a conference, at the Emergency Physicians Conference in Virginia. We're always welcome to come to more, but if you do have any questions, you can email us at the email listed here. So I think with that, Allison, I don't think we have anything else.
Okay, sounds good. Well, thank you again, Marcus, Hannah, and Morgan, for sharing your knowledge and information. We really appreciate it. So as with all of MSV's webinars, this will be posted on the MSV website at www.msv.org. And if you have any questions for the MSV team, please email memberservice@msv.org. And like Marcus said, if you have any questions for him or any EDCC related questions, you can see the email that he has in the PowerPoint. So with that, thank you all for joining us and have a great night.
Awesome. Thanks for having us.